Hi, so this is our group project for our CPCC clinical. It is the Break Guard, a smart system to facilitate safe lunch breaks for nurses' breaks for their lunch. There we go. Oh. All right, so Sarah will be next.
Okay. So the main problem with the unit is many of the nurses on the unit delay their lunch breaks and sometimes even miss them because of a lack of adequate system in place for lunch breaking, scheduling / distribution. Many of the nurses they become burnt out and tired, and they're at an increased risk of making errors, and because they have an impaired concentration because they're tired and hungry. So who's affected? Critical care nurses on the CPCC unit, the charge nurse, the nurse secretary, the nursing shift leader, the patients, and the hospital. The patients are mostly affected because just in case the nurses do become tired and their concentration is impaired, they might be liable. The contributing factors are limited staffing, lack of an adequate / proper lunch break system in place, limited time, charting burden, delayed patient care, lack of communication, and lack of enforced breaks / break policies.
Okay, my name is Avery, and I'm just going to talk about why this matters, just a little bit of evidence. So, evidence supports that fatigue increases medical error rates, and then breaks improve decision making, reaction time, and job performance. Breaks support patient safety and nurse retention, and regulatory requirements for uninterrupted breaks also support a improved workload for nurses. And 94% of surveyed nurses reported symptoms of burnout, which significantly increases the likelihood of clinical errors and negatively affects the quality of patient care. So our proposed solution is something we came up with called BreakGuard. This is a combined digital workflow system that identifies optimal times for breaks, assigns break buddies automatically, standardizes micro shift handoffs, provides charge nurses with real-time oversight, and ensures every nurse gets an uninterrupted 30-minute break at least once during their shift. So the first component to the BreakGuard is the Smart Break dashboard. And this would show real-time patient acuity, display nurse workload indicators, highlight optimal break windows, alert break buddy and charge nurse, prevent break during instability or unsafe windows. And the overall goal is just to increase break predictability and safety.
All right, my name's Tamae Fincher, and I'll continue to talk about the components of BreakGuard. So component 2 is going to create a break buddy system. So this will make sure that each nurse is paired with a partner who receives a micro handoff, monitors alarms and vital signs, handles any essential tasks such as time-sensitive meds or quick turns, and escalates any concerns if needed. The third component will include what the SBAR needs to have on it. Utilizing a structured SBAR format ensures that all essential clinical information is communicated clearly and efficiently. So the micro handoff should include what the SBAR means. So situation, the background, assessment, recommendations, and the benefit for this is that it improves safety and reduces communication errors. And then component 4 is the charge nurse oversight. So the charge nurses will use BreakGuard to track break completion, balance patient assignments, prioritize overdue breaks, and ensure safe timing for each nurse. BreakGuard allows charge nurses to efficiently track designated break times and ensure that all staff members, including themselves, receive their required breaks.
Hi, my name is Braden, and right now I'll be talking about the staff education and the policies about using Break Guard. So I want to educate on why breaks matter, because they can help prevent burnout, reduce stress, improve focus, Rest breaks can decrease errors and improve decision making, which is very critical in units like this, and boosts job satisfaction, which in turn can lead to better patient care outcomes. I'd also educate on how BreakGuard works. So BreakGuard uses a digital tool that helps identify the safest times for nurses to step away, and the system will monitor patient acuity, unit acuity, activity, and staffing to recommend break windows. For the break buddy expectations, we would complete a brief micro handoff before coverage begins, and we'd monitor the primary nurse's patients for any changes or alarms. And then the updated break policy would be all critical care nurses will receive one uninterrupted 30-minute break during each 12-hour shift. Breaks will be assigned and documented using the BreakGuard app. So barriers to implementation is staff shortages. So limited staff can make consistent breaks difficult. BreakGuard helps identify the least disruptive break times. Technology resistance. So some nurses may be hesitant to adopt a new system, and hands-on training and super users can help support comfort with the tool. With cultural norms of skipping breaks, some units are used to working through breaks, and education helps shift the culture toward viewing breaks as a safety requirement. Some concerns about patient instability, though, would be that nurses worry about leaving high acuity patients, and micro handoffs and real-time charge nurse oversight support safe temporary coverage. And lastly, for me, strategies to overcome barriers. We would provide short training modules that take less than 10 minutes and can be completed during downtime. We'd start with a small pilot on 1 or 2 ICU pods to test the workflow and gather feedback. We'd adjust the system based on frontline nurse input before expanding unit-wide. We'd use a standardized micro handoff checklist to maintain patient safety during breaks and create a quick reference cards for break buddy expectations and handoff reps.
Okay. My name is Malaysia, and we're going to talk about expected outcomes. So for nurses, we have lower fatigue. So with this one, it's reduced burnout with nurses, regular uninterrupted breaks, leading to better focus and decision making. We also have higher job satisfactions, improved morale from feeling supported and well rested. And we also have better retention, so that lower turnover rates as nurses stay in supportive environments with balanced workloads. For patients, that results in fewer errors, so well-rested nurses make fewer mistakes, improving patient safety. We have improved safety as well. So scheduled breaks ensure that nurses are always their best, enhancing care quality. And we have more consistent care. Timely breaks ensure continuous high-quality care without burnout. So for hospitals, this improves their outcome by policy compliance. BreakGuard ensures adherence to legal and hospital break policies because many nurses don't get breaks. We also have reduced turnover costs, so lower turnover by retaining experienced nurses, saving on recruitment costs. And lastly, better staff and morale, so enhanced morale with a more supportive and cooperative team. And all these are things that we are expected to better with BreakGuard. Okay, in summary, BreakGuard is a comprehensive solution designed to address critical issues around nurse breaks, improving both nurse well-being and patient safety in high-pressure environment like critical care units. So it addresses break-taking barriers, it improves nurse to well-being and patient safety. It uses evidence-based tool and standardized workflow. It creates predictable and safe break opportunities. It also supports quality care in critical care environments and ensure that nurses can deliver consistent, high-quality care, directly supporting improved patient outcome and team morale.
In conclusion, Break Guard would be very beneficial to any and all nursing staff on any unit it becomes available to. Here are our references that we have in our APA format. Thank you. Okay.